UT Psychological Clinic Protocol for Testing Face-to-Face, March 2022. The primary goal of these procedures are to maximize both client and clinician safety and test validity. This means maximizing distances between individuals while being able to complete therapy and testing in a valid manner. Clinicians should use their judgment when working with each individual patient on whether to adopt more stringent measures. Add clinician name and client number and scan this instructional document to each patient's file as an admin doc to confirm compliance. Before testing begins. When scheduling, clinicians should ensure that the patient/patient's family complete and sign Form 8 on TI's web portal before coming to the clinic. Clinicians should be familiar with all forms to respond to any follow-up questions/emphasize certain points. Clinicians will use HushMail for returning completed forms and sending links to complete questionnaires, after documenting consent to receive or send encrypted emails. Clinicians should call/HushMail their clients 24 to 48 hours before their meeting, reminding them that the clinic is following CDC COVID-19 protocols and that they need to reschedule testing if they are having any symptoms. Clinicians should also confirm that the patient has paid their fee in full before proceeding by checking their billing status in TI and requiring online payment in full before meeting. A HushMail template is available for use to remind patients of these points, including parking, etc. When sending this message, click on the green Add Form icon below Subject. This will send a COVID screen to be completed. Patients should be instructed to call 974-2161 if they need directions or other info. Day of testing. The assessment room will be open the day of testing for assessors to access materials. Clinicians will wait for and meet patients just outside the clinic's back door. Clinicians will give patients a symptom questionnaire via an iPad. Patients should complete this form each day of testing they attend and before entering the clinic. After completing/signing the screen, clinicians should review answers and electronically submit the form themselves. If clients report any COVID symptoms that cannot be better explained by other health conditions or circumstances, assessors should reschedule the appointment and enter an admin note in TI indicating the results of the COVID screen and the plan for rescheduling. The clinician should be seated about 6 feet away when not directly engaging with the client. All clients and clinicians in the clinic will be required to always wear. Clinicians and client/patients may opt to wear additional protection, such as face shield, protective eyewear, and/or gloves. Clinicians should wipe down all table and chairs used in their testing room with disinfectant before and after each patient. Clinicians are encouraged to use online administration of visual stimuli, matrix reasoning, visual puzzles, etc. via Q Global on the computer monitor in the testing room to maximize safe distances when possible. Patients should use a single-use pointer/pencil for answering multiple-choice questions to minimize patient touching stimulus books throughout the testing period. Take a pencil from the clean container and do not put it back. The air purifier should be on while in the testing room. All intake and feedback sessions will be done via Zoom. After testing, clinicians should wipe down all tables, chairs, doorknobs, computer keyboard, and mouse, iPad testing materials, and other surfaces that have been touched or used. Wipes will be available in testing rooms. Clinicians should return testing kits to the testing room after testing is concluded. Clinicians will scan all hard copy assessment protocols and place hard copies in their workroom mailboxes. To scan, select Scan, then select Address Book, then press the PQRS button, then press Scan, and then proceed to scan all pages. Email Charlotte and Christy that you have raw data for client number to be attached in TI. Charlotte and Christy will attach all scans in the patient's TI file. Clinicians should review the scans for clarity/completeness. Once reviewed and approved, assessors can securely destroy all materials using the workroom shredder.